Hello, I'm Mrs Anne Mitchener, consultant neurosurgeon at Clementine Churchill Hospital in Harrow. Today I'll be sharing my knowledge about the recovery period following spinal surgery, of which there are many types of procedures. I've performed most of the different types of spinal procedures in my career, so you can count on me for expert information and advice. What are the main types of spinal surgery? Some of the most common types of spinal surgery are decompression surgery, disc replacement surgery, fusion surgery, deformity correction surgery, cancer removal surgery, and surgery to repair a fracture in your spine. Spinal surgery for degenerative problems in your spine, which cause symptoms such as constant pain and stiffness, are some of the most common types of spinal surgeries. What happens during spinal surgery? Spinal operations are quite varied and are dependent on the aims of the procedure. For example, a simple discectomy involves taking a small piece of disc from your spine, while a spinal decompression involves cutting a piece of bone away to improve the space for nerves and alleviate pain. Spinal fusion surgery involves the insertion of metalwork. This can include surgery from the front or back of your spine to place screws and rods to hold your spine rigidly in place. You might need the vertebrae themselves, which are the bones that make up the spinal column, fused together, and for this we insert a spacer, which is called a cage. Many procedures can now be performed using minimally invasive surgery, known as a keyhole technique, and most are performed to take the pressure off your nerves and stabilize the bones in your spine. What is the recovery period like? Your recovery journey depends entirely on what procedure you have. Following a discectomy and decompression surgery, which aims to treat compressed nerves in your spine, you can usually return to work within 3 to 4 weeks. Following minimally invasive fusions, you usually need up to 6 weeks. Following cervical disc replacement surgery, which is needed when the soft cushion of tissue between the bones in your spine pushes out of place, you can often get back to work within 2 to 4 weeks. Recovery from spinal surgery requires time and patience, as well as being kind to yourself, so that you recover as quickly and safely as possible. The time required depends on the extent of the procedure and your reason for having surgery in the first place. No two people recover at the same rate. The guidance and supervision from your consultant, physiotherapists, specialist nurses and occupational therapists are very important while you recover. You will be treated by a multidisciplinary team of people who will help guide you in your rehabilitation to returning to normal life. Immediately after surgery, you'll have some pain in and around the area that was operated on. You'll be given pain relief to relieve your pain levels and get you moving as quickly as possible. The original pain you had before surgery usually improves very quickly, but let us know if you still feel intense levels of pain like before. It can typically take up to 6 weeks for the general pain and tiredness after your operation to disappear completely, but this varies from person to person. What is physiotherapy like after spinal surgery? Physiotherapy after spinal surgery is a very important step in your recovery process, focusing on restoring your mobility, strength and function, while minimizing your pain and preventing further injury or complications to your back. Your physiotherapist will get you up and moving very quickly after surgery to kickstart your recovery almost immediately. Physiotherapy involves activities like specialist personalized exercises, pain management techniques, and tailored movements to improve your symptoms and get you moving as freely as possible after surgery. You will work with a dedicated physiotherapist who will understand your circumstances and build you a recovery program based on your individual needs. They will set your goals and monitor your progression as you ease back into everyday life. How long will I be in hospital? You will usually be able to go home about 1 to 4 days after your operation. The length of time you spend in hospital will depend on the specific type of surgery you had and your general health. When you arrive home, it's very important to take things easy at first, gradually increasing your level of activity every day. Some support at home from a friend or family is usually needed for at least the first week after surgery. You will need assistance when climbing stairs or reaching for items in the cupboard. Exercising will help speed up your recovery, but make sure you perform the exercises set by your physiotherapist and try not to sit or stand in the same position for more than 20 minutes at a time, because this will make you feel stiff and sore. Walking is a very effective way to keep active while avoiding high-impact exercise. Do not do any heavy lifting or awkward twisting and leaning when you are performing your usual everyday activities at home. When you can go back to work will depend on how quickly you heal after surgery and the nature of your job. Most people return to work after 4 to 8 weeks if their job isn't too physically demanding. Most people feel ready to drive after 2 to 6 weeks, depending on which spinal surgery you had. We hope this video provides you with the information you need ahead of your spinal surgery. If you have any questions, feel free to leave them in the comments section below this video. If you would like to arrange a consultation with me or the nearest consultant in your area to discuss your specific spinal surgery in even more detail, you can book an appointment at circlehealthgroup.co.uk.